Discover the secret to prevent prostate problems and live healthy. If you are a man or have a man in your life, you have surely heard about prostate problems as you get older. Dr. Rina Malik, urologist and pelvic surgeon, reveals how to prevent an enlarged prostate.
Whether you're a man or you have a man in your life, I'm certain that you've heard of men having issues with urinating when they're older, all because of an organ called the prostate. Well, have you ever...
The prostate is a walnut-shaped gland that surrounds the urethra and, when enlarged, can cause hyperplasia and, in severe cases, prostate cancer. The video highlights that prostate growth depends on androgens such as testosterone.
Wondered if you can actually prevent yourself or someone you love from getting prostate issues? I'm Dr. Rina Malik, urologist and pelvic surgeon, and today we're going to talk about
which is converted to DHT in the prostate, promoting its growth. However, aging decreases testosterone, but does not stop prostate growth. Dr. Malik explains how to avoid this problem by understanding that benign prostatic hyperplasia is due to an increase in epithelial.
Preventing prostate enlargement, what can you do? The prostate is a walnut-shaped organ that sits underneath the bladder around the urethra, which is where you urinate from. And
stromal cells in the prostate, caused by growth factors and chronic inflammation. Inflammation, caused by infections, hormonal changes, and alterations in the prostate microbiome, creates a vicious cycle of growth and inflammation.
As it grows, typically it goes from having normal prostate tissue to having growth of the cells in the prostate called hyperplasia.
The solution lies in avoiding metabolic syndrome linked to diabetes, high cholesterol, hypertension, and obesity, or fostered by a Western diet high in fat, red meat, and simple carbohydrates. Increasing physical activity is crucial.
A lot of men goes on to develop abnormal cells and sometimes even prostate cancer. But can you stop it? So when you think of prostate growth, in order for the...
Studies show that light exercise reduces the risk of BPH by 30%, and moderate and vigorous exercise increases that reduction. Walking more than 2 hours a week can reduce the risk by 27%. It's less than 20 minutes a day.
Prostate to grow, at least through adolescence and to early adulthood, you need to have androgens. It is very androgen dependent. Now, what's an androgen? That's things like...
Staying active and controlling weight are key to preventing prostate problems. For more details on how to prevent and treat an enlarged prostate, watch the full video in the description. Greetings in the name of Jesus and thank you.
Testosterone. And in the prostate specifically, when testosterone reaches the prostate, it's converted by an enzyme called 5-alpha reductase to something called DHT, or dihydrotestosterone. Now, this is found in the prostate in a very high concentrations, and it binds to proteins in the blood at a much higher concentration than that of testosterone because it has a stronger affinity. So dihydrotestosterone is found in the prostate in much higher